Now, sticking with RFK and the National Institute of Health, we take a look at this. This is RFK Jr.'s autism study to amass a medical records of many Americans. This sounds vaguely familiar. I think I read about this in 1930s Germany as well. Eugenics, Jewish background, Aryan. Because this is exactly what they did back then too. Take a look. The National Institute of Health is amassing private medical records from a number of federal and commercial databases to give to Health and Human Services Secretary RFK Jr., his new effort to study autism. The National Institute of Health's top official said Monday. The new data will allow external researchers picked for Kennedy's autism studies to study comprehensive patient data with broad coverage of the U.S. population for the first time, says Jay Bakshikara. JB. We'll just call him JB. No, I don't want to say that either because that might get confused with Pastor JB. We'll just call him Bat. I don't know. The idea of the platform is that the existing data resources are often fragmented and difficult to obtain. The NIH itself will often pay multiple times for the same data resource. Even data resources that are within federal governments are difficult to obtain, he said in the presentation to the agency's advisors. Medication records from pharmacy chains, lab testing, and genome data from patients treated by the Department of Veteran Affairs and Indian Health Services, claims from private insurers, and data from smartwatches and fitness trackers will all be linked together. So pharmacies, lab tests, doctors, your genome data, patients treated by the VA or Indian Health Services, private insurance companies, data from wearables will all be linked together and storing a single medical record in a giant database for them to hold about you. Now they're saying it in the name of autism. But this has to do with keeping track of everybody's health data. If we move over to here, the NIH says it will build a health data platform linking health records, genomic profiles, and smartwatch data for medical research. The National Institute of Health is quietly assembling a vast digital mosaic of Americans' private medical histories, pulling sensitive data from both government-run health systems and commercial sources to support autism research tied to Health and Human Services in RFK Jr.'s latest project. A new scheme involves a sweeping plan to integrate diverse streams of health data into a single platform, raising significant concerns about privacy, oversight, and long-term use. You don't say. According to NIH Director Dr. J, and see, now Dr. J sounds like the old basketball player. Again, this dude's name is just giving me problems. The data aggregation includes pharmacy transactions, insurance claims, clinical test results, and even personal metrics collected from wearable tech such as fitness trackers and smartwatches. Oh my goodness. This is not the autism registry that has been reported to be developed, something that the Department of Health and Human Services has denied. They announced it, then denied it. Keep in mind on that. Instead of a traditional registry, what the government calls a real-world data platform will be established. Platform will link data to support research into the cases of autism. So let's just get everybody's medical details and live track everybody's medical details, all in the name of autism. Health information from the VA and Indian Health Services will also be funneled in, creating a massive centralized repository with a wide lens in the United States population. As Dr. JB, I see that doesn't work either. Man, this dude's name told agency advisors on Monday the objective is to eliminate the fragmentation that currently limits access to existing health data sets. He said that the new system would cut down on redundancies and make it easier for researchers to construct their analysis. So if we take a look at this, the goal, broad coverage of U.S. population, computer resources, federal partnerships, AI implementation. This includes gathering data about you from your pharmacy, from your health organization, from your clinic, from clinical data, from your claims and billing, your medical billing, from environmental situations and facilities, as well as all of the stuff that you wear and use on your phone or Fitbits or whatever it is. Every bit of your medical information is going to be gathered and live tracked and put into a central data hub, allowing them full access to every bit of your medical history. This will grant them access to real-time health monitoring, national disease registries, drug development, longitudinal data sets, regulatory approvals, and research competitions, as well as just having full information about you and your tracking. This will be a part of your social profile. They've got all your data. It's scattered right now. They're going to put it all in one place, along with all of your other stuff. Remember, this is what we've been talking about, that cloud, AI cloud communication that we just did on Saturday, basically allowing AI through Palantir and Google Cloud to have full access to all data and go back down to federal systems. It allows AI to go up and down. This is now going to be put into that as well. This is now going to be put into that. To expand the reach even further, the NIH is now in discussions with the Centers for Medicare and Medicaid Services to loosen restrictions on federal health data sharing. If finalized, this would open the door to some of the most detailed and longitudinal health records in the country. Y'all still think that RFK is on our side? But he got rid of the chemical food dyes. And he's making it so fast food French fries will be cooked in beef tallow. Cool. All this information, ranging from genomic profiles to step counts, will be linked with the NIH's new research environment, where outside researchers selected for the autism studies will be allowed to analyze it. And so on and so forth. I think we get premise and the idea on this. It's all about keeping tabs of people, all about keeping live tracking of people, all about having every surveillance module down to your cellular level running, all on a centralized database with access for AI to go to and from and gather whatever data that it needs to in that moment. But what's fascinating, and this is the kicker. This is the kicker. All in the name of autism, right? Well, here's a report from AP. This is what, April 15th. And it says autism rate in the United States rise again to 1 in 31 kids, CDC says. If we jump down here, we get a quick little point that I want to point out. An estimated 1 in 31 U.S. children have autism, the U.S. CDC reported Tuesday, making another jump in a long string of increases. The CDC's data was from 14 states and Puerto Rico in 2022. The previous estimate from 2020 was 1 in 36. So in 2020, 1 in 36 kids had autism. And in 2022, 2 years later, it jumped to 1 in 31. So it went up 5 points. What happened in 2020? What was thrown about for everybody to take in 2020? How many mothers, expected mothers, took that before giving birth to kids? I can't tell you because of the platform I'm on. But I'm thinking you can connect the dots on that one. Why am I bringing this up? Well, because we know that RFK Jr. doesn't want to block those anymore because he works for the self-proclaimed father of those things. So why would he remove that? Especially since Trump and Musk and RFK and countless others in the administration all have investments in companies that make those things. Half of Trump's administration are investors and or involved in companies that do those things. I think I know where it's coming from. But I could, be wrong. Don't think I am. I could be wrong. We can't talk much, again, about this subject in particular because of where we're at. They're still pretty sensitive about it. They get their panties in a bunch when discussed. But I'm sure you guys can fill in the blanks and connect the dots and so on and so forth regarding that. All right. On to the last one, right? We did that. Yep, on to the last one. Let's take a trip back to 1918, shall we, on this. Coming 24th of April this year, researcher of the 1918 flu virus, the Spanish flu virus, takes over the NIAID, the NIAID. Jeffrey Taubenberger, yes, he is German, by the way, becomes acting director of NIH's second largest institute. Take a look. Jeffrey Taubenberger, who gained fame for unearthing samples of the 1918 Spanish flu virus and ultimately sequencing its entire genome, has been named acting director of the National Institute of Allergy and Infectious Diseases. Yes, this guy thought it was a good idea to find a strain of the Spanish virus, the Spanish flu virus. And if that wasn't good enough, he thought it was a good idea to rebuild it for fun. And he is now the head of the National Institute of Allergy and Infectious Diseases. Taubenberger, who has been an intramural researcher at NIAID for nearly 19 years, replaces HIV/AIDS researcher Janine Marazzo, whom Donald Trump administration removed from the job on the 31st of March. Marazzo, who remains on leave from NIAID, was one of 6 heads of institutes and centers at the National Institute of Health, recently offered reassignments to the Indian Health Service for no identified reason by NHI parent agency, the Department of Health and Human Services. Taubenberger will be running an institute that had a $6.6 billion budget in 2024, making it the second largest NIH branch before Marazzo, I don't know how to pronounce that, took the helm in NIAID in 2023. It had been headed for 38 years by infectious disease scientist Anthony Fauci. Hang on to that name. Just take that name and put it in a little box, put it in a bow, put that in your pocket, save it for later, we'll pull it out. In recent years, Fauci drew the ire of many Republicans and others who disliked this public health advice during the coup, or even blamed NIAID for funding a Chinese lab that alleged triggered it. Taubenberger takes over as the White House seeks to reorganize the NIH and drastically cut its budget. Although he hasn't managed anything the size of NIAID, his scientific credentials are long, colleagues said. He led a team that sequenced the virus that caused the 1918 Spanish flu pandemic, extracting samples from autopsies of soldiers and an Inuit woman buried in the Alaskan permafrost because, for fun, he was made many critical contributions to the field of influenza, both in pathogenesis, animal models, human data, and those things. It says virologist Adolfo Garcia Sastre of the Icahn School of Medicine at Mount Sinai, who worked with Taubenberger before he went to the NIH in 2006. Flu researcher Richard Webby at St. Jude Children's Research Hospital said Taubenberger has a lot of experience, I would hope, for an NIA director. Taubenberger will start the job tomorrow, according to the email to staff, so he's already plugged in now. NIH's Deputy Director Mamoli is a flu researcher himself and collaborated with Taubenberger for many years. They have published more than 30 papers together. So Taubenberger is taken over. This is the clown that decided, let's find the Spanish flu virus and let's rebuild it, and we're going to do such and such. Let's keep moving with this train, shall we? Train kept rolling. The deadliest flu, the complete story and discovery and reconstruction of the 1918 pandemic virus. If you guys don't know, the 100-year anniversary of the 1918 pandemic and the 10-year anniversary of the 2009 H1N1 pandemic are milestones that provide an opportunity to reflect on the groundbreaking work that led to the discovery, sequencing, and reconstruction of the 1918 pandemic flu virus. Collaborative effort advanced understanding of the deadliest flu pandemic in modern history and has helped the global public health community prepare for the contemporary pandemics such as 2009 H1N1 or possibly something else. We'll take a look. The 1918 H1N1 flu pandemic, sometimes referred to as the Spanish flu, killed an estimated 50 million people worldwide. This thing dramatically changed the landscape of the world when this thing happened, and it's extremely deadly. Let's jump down. There's a few points I want to point out on this. You can see a picture here over on the right. It's a picture of Dr. Jeffrey Taubenberger and Dr. Ann Reed reviewing a genetic sequence from the 1918 virus. They are credited with sequencing, rebuilding the genome of the 1918 virus. They're the ones that said, let's take this deadly virus that is dormant, rebuild it, and make it active again. That's what they did. It says, where's it at? Just right here. In the article, Taubenberger and his team described their initial work to sequence part of the genome of the 1918 virus. The genome is the complete list of the genetic instructions that make up the organism, similar to the blueprint for the construction. Many people are familiar with the concept of DNA, which is dual-stranded and determines the fundamental genetic characteristics of nearly all living things. However, the genome of an influenza virus consists of a single strand of RNA instead. Taubenberger's team successfully extracted the RNA of the 1918 virus from lung tissue obtained from a 21-year-old male U.S. service member stationed in Fort Jackson, South Carolina. The serviceman had been admitted to the camp's hospital on September 20th, 1918, with a diagnosis of influenza infection and pneumonia. He died 6 days later because of that. From this tissue, Taubenberger's group was able to sequence 9 fragments of the viral RNA from 4 of the virus's 8 gene segments. This work did not represent a complete sequence of the entire 1918 virus genome, but it provided a clearer picture for the pandemic virus than ever before. Based on 1918 virus's sequence data Taubenberger assembled in 1997, he and his fellow researchers initially claimed that the 1918 virus was a novel influenza A virus that belonged to a subgroup of viruses that came from humans and pigs, as opposed to birds. However, still much to learn. And it goes on. They worked on it. They finally, with some help from other guys, they finally put it together and constructed the thing, making it active. So if we jump down here, there's one last part I want to point out on this. For the reconstruction of the 1918 virus, additional rules were created to govern the experiments to be conducted. For example, to prevent mix-up and cross-contamination, work on the 1918 virus could not take place alongside other influenza viruses at that moment. But they ended up doing such when they started working on poultry. This is where we just kind of got to think critically for a moment. Where's that? Down here. The impact of the 1918 virus on lung tissue was also studied using a human lung cell. The amount of the flu virus was measured in the cells of the human lung. Another set of experiments was conducted to better understand the possible avian origins of the 1918 virus. The earlier sequencing efforts led by Dr. Taubenberger and Reed had suggested that the 1918 virus gene segments were more closely related to avian influenza A viruses than the H1N1 viruses found in other mammals. Researchers were interested to know whether the 1918 virus would be lethal to fertilized chicken eggs containing embryos, and so they went on and did experiments regarding those eggs. You can see it right here, CBD laboratory on that. So here's a question with this famed bird flu going on. And we got this dude who reconstructed this thing and basically said, oh, it's all about poultry and birds and can jump to humans and so on and so forth and is the deadliest thing. Could there be something in the future? Well, let's just keep going. Just a couple more things to show you. 1918 influenza, the mother of all pandemics. This was a research study done in 2006 by Jeffrey K. Taubenberger and David M. Morins. Hang on to that name. Taubenberger, Morins. If we jump over to this one, the H7N9 avian influenza A virus and perpetual challenge of potential human pandemicy. David M. Morins, Jeffrey K. Taubenberger, Anthony S. Fauci. This was done in 2013. You do a little digging, there's a lot of information that you can find. We're not going to go through all of it. But I just want to point this out. Jeffrey Taubenberger, chief of the viral pathogenesis and evolution section at NIAID and a pioneer in the controversial reconstruction of the 1918 pandemic influenza virus, was carbon copied on a May 2020 email strategizing about how to recruit leadership at the prestigious American Society of Tropical Medicine and Hygiene to protect eco-health. Jeffrey Taubenberger was working with David Morins and Fauci and was helping publicity and funding for the COOF stuff, the actual virus itself. To that end, Morins and Taubenberger co-published a July 2020 op-ed in the Society Scientific Journal, the American Journal for Tropical Medicine and Hygiene. Taubenberger lent his credibility to the argument that the theories about a hypothetical man-made origins of the COOF have been thoroughly discredited by multiple virus experts. The virus that caused the COOF is thus a virus that emerged naturally. The article that Taubenberger wrote with Morins and Fauci. Morins described the article in an email to a science reporter, CCing his co-author Taubenberger as a publication that defends Peter and his Chinese colleagues. Why? Because they were helping Fauci fund it. The reporter thanked Morins and offered to link it to the recently published article, an interview with Xi in which he refused the lab leak theory, demanded an apology from Trump, and deemed the suspension of the EcoHealth grant absolutely absurd. Taubenberger, to be put into that position, must be selected by RFK Jr. and Dr. J. Baki, whatever his face is. They're the ones that installed him. Knowing his background, who he's connected to, what he's done, and he's now the next Fauci.